Thank you, Seamus, and I'll try not to keep everyone from their coffee for too long. So I'm deputising here today really for Professor Ruth Clifford, who is the beating heart of our Cancer Trials Unit in Limerick. And undoubtedly it's through her leadership and that from Maureen O'Grady that we have been able to achieve a lot of what I'll discuss today in this grant cycle and the other things that we aspire to achieve over the coming years as well. So just, I guess, a little bit on background from the point of view of Limerick Cancer Trials. We offer this to a population of about 420,000 patients. We have an extremely diverse patient population, quite similar to what we've just heard about. Our patients generally live in quite a rural locality. They're of an older age, but very, very significantly, about 1 in 4 of our patients live in what is defined as social deprivation, with over 10% living in what's defined as extreme social deprivation. From a cancer care point of view, obviously medical services are delivered across 6 hospitals in the region, but cancer services are centralised in UHL, and we've over 2,500 new diagnoses of cancer per year. Our Cancer Trials Unit, established since 2018, has opened 64 studies with just over 1,000 patients recruited to date. We have very strong links with our academic partners. This is something we're very invested in continuing to grow, particularly with the University of Limerick, and the huge opportunity that's offered for collaborative research with the Limerick Digital Cancer Research Centre, also led by Aideen Culhane. There's also a UL research centre based on the UHL campus to try and foster that collaboration even further and bridge that gap between academic and clinical institutions. So I guess applying for this grant offered us a real opportunity within the Cancer Trials Group to maybe take a step back and reassess our strategic approach to not just cancer trial delivery, but also the cancer groups that we focus on. I guess over the past number of years, there probably has been an inconsistency in momentum, both to trial opening and trial recruitment within the unit, and that's something that was recognised as needing perhaps a fresh approach to. So our overall aim was to focus on some of the larger cancer groups that are very relevant to our patient population. And here we can see the number of trials that are either open or opening in our unit by the end of 2025 across not just interventional trials, but also looking at some translational work, observational work, and biobanking. Key to delivering our work has been development of subgroups that have both a clinical and an academic PI. Whilst these initially commenced as disease-specific subgroups focusing on the big cancer groups that are relevant to our patient population, this has also expanded into a formal biobanking subgroup, cancer nursing, allied health, led by Rose Galvin, a physiotherapist and professor of physiotherapy in UL, but also PPI subgroup, the clinical lead of whom is actually a patient. And I think this is very important. And there are also PPI representatives throughout each of the subgroups and inform all of the research that we do. And that's something that we're very proud of and it's recognised as being hugely important to all trial design and delivery. And I guess, touching again on, applying for the grant and understanding, well, if we've had challenges with maintaining momentum in both trial opening and trial recruitment, well, how do we address these and avoid these and future-proof delivery of cancer trials in our group moving forward? And this really gave us an opportunity to take a step back to look at, well, what are our population needs? What are the specific opportunities we have within our region to deliver on clinical cancer trials, and what is our experience that we can lean into as well. And I think, really focusing on certain things like marginalised groups where we have a large population of patients coming through, really looking at a digital focus to what we're doing, particularly as we have such a well-established digital cancer research partner in UL, and then also leaning into our own experience working both nationally and internationally with different groups, both in developing real-world data and also clinical trial data. So these were the kind of 5 strategic areas and work packages that we focused on as being important and deliverable from the point of view of the group that we have in Limerick and the patient population that we serve. And over the next number of slides, I might just talk about how our subgroups actually work using blood cancers from Ruth's group as an example. We'll talk a little bit about inclusive clinical trials, again working with those from marginalised populations, which is a significant number of patients that we work with every day. And then I'm going to take the utter liberty of talking about colorectal cancer at the end as a colorectal surgeon. So this is an example of a subgroup led by Ruth, so focusing on blood cancer research. In 2025, they have opened or will be opening by the end of 2025 up to 12 clinical studies, 5 of which are IMP, working with national and international collaborators to achieve that, all of the above that you can see here. Ruth has also developed the CLL Alliance, working with her clinical colleagues to really understand the research needs of patients with CLL so that that can further inform study design moving forward. Again, building on our relationship and strengthening our relationship with both the university and international collaborators to maintain a translational element underneath all of this that will then lead to clinically impactful opportunity for research. And this has already started. The blood cancer research group is obviously, the most advanced of all our research groups, but is a very good example of how this can be achieved. All of this leads to, recruitment of postdoctoral researchers, clinical research fellows, MDs, people who want to come and do research, and that further allows us to invest in the sustainability of delivering all of the aspirations that we have from clinical trial delivery. Inclusive clinical trials, so this I think is just an absolutely crucially important and fantastic element and work package of our grant. And this has really been led out by Dr. Niamh Peters, who's a consultant medical oncologist, and Dr. Patrick O'Donnell, who's a professor of social inclusion in UL. Niamh and Patrick were awarded a Movember grant to work on this, particularly in prostate cancer patients living in rural areas of an older age. These are obviously patients that are very difficult to recruit into cancer trials, but obviously they comprise a significant proportion of prostate cancer patients that get prostate cancer. So really understanding the barriers to why these patients cannot participate in trials is firstly very important, but a key element of the research that is ongoing with Niamh and Patrick is developing an intervention that is social care worker pathway to really work in partnership with patients who fit this demographic to really demonstrate, I guess, that this is something that we can overcome, but we need to actually define that pathway, test that pathway, and use patients to inform and design that intervention with. And I'm really excited to see how this will pan out in the future. And then just to finish up talking about colorectal cancer. So this is, I guess, a new cancer group we've added to the trials portfolio in Limerick. And I mean, we've huge opportunity to do colorectal cancer clinical trials. In our unit alone, we surgically treat over 200 colorectal cancers per year. And in the past 2 years, we've seen a 33% increase in those diagnosed with colorectal cancer under the age of 50. And we have not been offering any opportunity to any of these patients to participate in clinical trials. Our clinical research is very much focused on, clinical pathways that optimise the perioperative pathway for patients, and in more recent times, focusing a lot on social deprivation and observing some really excellent outcomes and targeted screening interventions in direct provision. From January 2026, we're very much on track to open routine biobanking for all colorectal cancer patients treated in our institution, both from tumour adjacent and peripheral sampling. And that will give us a really solid foundation to start increasing our translational research output in that regard. Training and education is obviously a very important work package within our grant for this cycle as well. From my point of view and from a colorectal point of view, we do a lot of work in robotic colorectal surgery training, working with both industry partners, IMRA and RCSI here, designing how we train trainees to perform cancer operations and colorectal cancer operations. And this is something we'll continue to develop and keep as an important strand of all that we are doing. But most importantly, I guess, we need to to start doing trials. And that's what we're talking about here today. And as a surgical community, we have been very poor in delivering on surgical trials, but we now have no excuse since the development of the National Surgical Research Support Centre here in RCSI, and it's great to see Anne-Marie here today. We have a phenomenal support structure available to us to deliver surgical trials, so now is the time to start doing it. We will have 2 MD students starting with us in Limerick. One will be focused on robotics, but one will be specifically focused on developing a rectal cancer trial, starting in July. And that's, obviously will give us the capacity to try and do this. We are already close to starting to recruit for Koala, which is a survivorship interventional trial in patients who've had rectal cancer surgery. We're the only Irish centre that's going to participate in this, but we're collaborating with partners in the Petermac and Melbourne and some partners from London to do that. But more recently, we've just submitted an NREC application for a medical device intervention post-rectal cancer surgery to improve bowel function for patients. And of the 8 rectal cancer surgeries in Ireland, 6 have committed to delivering on this trial. So it's a baby step, but I think it's a really important step. For my fellowship, I worked in France. I worked with the president of the Greco group. So this is a rectal cancer trials group in France that has delivered now close to 21 clinical trials in colorectal cancer surgery. So this is really what we need to be focusing on to aspire to. And certainly from a commitment point of view of colleagues around the country, this trend is reflective of what's happening. We are not recruiting these patients to trials, and we need to start doing so. And there seems to be appetite to do so as well. So having everyone in the room here today, I'm shamelessly asking for your support to do so. Thank you.